teachers, and even professors, they drink silly. Okay, many of them, not everyone. Okay, they drink silly, drink mpaka they sleep in the bars. And of course, the question that always comes is, if these learned people are doing it, I mean, me who didn't even go to school, who am I? How can I say there's something wrong with it? Okay, so people reason that way and say, this thing is good, there's nothing wrong with it. And worse than that is that medical workers, okay, if you're a professor of history and geography, and you don't know these things, you might be slightly excused, although you're not really excusable because knowledge is available everywhere. And at university level, you are supposed to have a functional knowledge of everything. Not just a few things, not just your field. You should have a functional knowledge of everything so that everywhere you can engage in intelligent discussions. But so the worst of them is academicians who are in the medical profession, who have all these details, and yet they still abuse alcohol. It's a tragedy. But one thing it tells you is that human nature is sinful, is corrupt, is wicked. Education does not make you a saint. Education only makes you an educated sinner. So you can have all the knowledge in the world, but if you do not know God, you are still a fool. And that's why Proverbs 1 says that the fear of God is the beginning of knowledge, but fools despise instruction and wisdom. Proverbs 1 verse 7. Okay, and that will be our text for today. The fear of God is the beginning of knowledge, but fools despise instruction and wisdom. And so all the science is there, the truth. I know that in the 1840s, when the young teenage girl, Ellen White, was being given visions by God about alcohol and tobacco and these drugs of abuse, and even drug use in general, the medical profession was not well informed. And many thought that she was crazy because of the things she was saying. They were then not known in the scientific world. But currently, as time went by, scientific research brought out all these facts. And today we are well informed about alcohol, what it is. And more than that, we are able today to gather a lot of data on those who drink and get to know exactly what alcohol does to them and to society. Is there any use of alcohol? To be frank, alcohol is not a natural substance. It's not a food. It's not something natural. It is a metabolic breakdown, a metabolic product of breakdown of sugars. So it is a byproduct of breakdown of sugars by bacteria and yeast fungi. That's where our alcohol comes from. So it's not something God created. No. It's something we discovered on our own and decided to put to use through simple experimentation. You know, as we read yesterday, what Noah did. They, even at that stage, knew about alcohol and how it makes people drunk. Okay. So now, the science of it. What exactly is alcohol? What does it do to the body? Okay. What diseases does it cause? This is what we are want to go through. Okay, so introduction. The major alcohols, okay, are ethanol, methanol, and ethylene glycol. Methanol and ethylene glycol are chemical reactants, okay, chemical solvents used in the manufacturing industry for various products like plastics, drugs, and many chemicals. It's a solvent, it's an organic solvent. okay, for many of industrial products. That's where they find the use. But alcoholic drinks, when people take alcohol for pleasure, the alcoholic drinks, what it contains is the alcohol ethanol. Ethanol is a psychotropic substance taken because it induces feelings of increased confidence and relaxation, like all the other drugs of abuse. Okay. A psychotropic substance is anything that affects the mind and thinking. Okay. So ethanol is a psychotropic substance. It affects your thinking, it affects your mind. Its use has been with us here since the dawn of human history and was associated with rituals and social occasions. In traditional society, alcohol was not really abused because, number one, it was not available every day. It was only made at special occasions and special situations. Okay, during harvesting, after harvesting, to celebrate the good harvest, okay, alcohol would be made and people would get together and drink and enjoy their alcoholic drinks. But after the party, it was no longer there, and that was it. You forgot about it. Whenever there was a marriage ceremony, alcohol would be there for the wazes. Whenever there was war or fighting, quarreling, differences, and people came together, sorted out their differences, and made peace with one another, they would not only offer sacrifices and eat meat to celebrate the occasion, they would also have alcohol to celebrate the occasion. So traditionally, alcohol was used, but in a more or less, we would say, a responsible manner, in a controlled situation, just like God was trying to do with these people. When in Deuteronomy 14, we read that God allowed his people to turn the third tithe into money, go to God's house, and whatever you wanted, whatever meat you could buy, even including strong alcohol. Okay, so that is used in a controlled manner so that it is not abused. Today, it remains popular and features in social life everywhere, in cities and villages. It's the most commonly abused drug worldwide, not only in African countries, most African countries, but worldwide. The only places you may get alcohol abuse spared or minimal is Muslim countries, because there it is banned, its use is banned. Muslims are not allowed to use alcohol. And they don't just bembeleza you. You know, the problem with us Christians and Christian countries, the Christian religion is not the same as the government law. So we can be there preaching and teaching, but people have all the rights to reject our teaching or accept it. They are not forced. Not so with Islam. With Islam, when what the religion says is what the government says, they are one and the same thing. And so if you disregard what the Quran says, you are in trouble, you'll be punished. In fact, in Muslim countries, if you are caught drinking alcohol, okay, they strip you naked and whip you in the public square. It is the drug that produces the most serious health and social consequences. Is ethanol a drug? Yes, it is a drug. Why? Because it affects living cells, stimulating or inhibiting their normal natural function. So it is a drug. Alcohol is a drug. Ethanol is a drug that produces the most serious health and social consequences. Now, the epidemiology of alcohol abuse. Alcohol use is found among all age groups from late childhood, that is 9, 10, 11 years, to the elderly. But peak use or initiation of use is around 14 to 18 years. And then the people who use it most are those who are aged 15 to 65 years. In both sexes, with a higher preponderance among males, and in all socioeconomic groups. It's not only the poor who drink, the rich drink even more than the poor. In Kenya, a study showed that 70% prevalence of alcohol drinking among adults. and 17.7% prevalence among school-going youths below 19 years of age, and 77% among non-school-going youths below 19 years. Yeah, they're idle, and an idle mind is the devil's workshop. And so among those who are not school-going, the youths who are not school-going, a whole 77% of them, yeah, drinking. In the US, studies show that 75% of adults drink regularly. 78% of students have drunk before graduation, and alcohol is the number one. Other drugs, third. In Peru, South America, it begins at 12 years. 75% of population drink, 60% of males drink at 14 to 16 years, females 70%. The largest consumers are males, 31 to 40, and females 20 to 30 years. In Spain, just about the same figures, 88.8% population have tried alcohol, 78% in the previous year, 15% drink daily. Of students, 75.7% of the 14 to 18-year-olds have drunk. Average age of starting is 13.6 years. In South Africa, the problem is just as big as in Europe. The yearly cost of alcohol-related problems in the US is about $300 billion. Over 22,000 alcohol-related deaths from road traffic accidents annually. These figures keep changing every year, okay? But it's on average about there, okay? These were some figures for some time back. 2 million near fatal injuries and damage to 5 million vehicles. It is responsible for 5% missed work time, 25% decreased work performance. Alcohol abuse has decreased their lifespan by 15 years. It causes 25% premature deaths in men and 15% in women. 30% of all admissions have coexistent alcohol problems. They generally have a poorer treatment outcome. Alcohol causes more preventable morbidity, that is illness, and mortality, that is death. Okay, it causes more preventable sickness and death, morbidity and mortality than all other drugs combined together, with the exception of tobacco, which does more damage than alcohol. So in our every estate in Nairobi, the moment the houses are coming up, one of the first things to arrive with the housing estates is beer, dens, bars, and they just keep growing. The pharmacokinetics of alcohol, that is, when you take alcohol, okay, what happens to it? Okay, just like when you take food, what happens to the food? From the time it enters your mouth, yeah, until it enters your blood and reaches your brain, what happens? Alcohol is a small water-soluble molecule rapidly absorbed from the stomach and the small intestinal mucosa, with peak plasma levels at 30 to 90 minutes. The rate of absorption is reduced in heavy smokers in the presence of food and is partly genetically determined. Okay. It is partly metabolized by alcohol dehydrogenase, an enzyme an enzyme for breaking down alcohol, found also in the intestinal mucosal wall. Women and alcoholics have less of this enzyme. And so because they have less of this enzyme that breaks down alcohol, ladies get drunk with very little quantities compared to the amount which makes men drunk. And so they have a lower blood level. They need only a much lower blood level to become drunk, while men need a higher level to become drunk. It is after absorption, well distributed to various body tissues, to the brain, to the nervous system, and the tissue levels are approximately equal to those of the blood. Now, so you take it, it is easily absorbed, it reaches the blood, it is carried everywhere in your body, including your brain and nerves, where it does most of the damage. But wait a minute. Why does that's the body? The body breaks it down. So what is the problem? The problem is that there is just so much that your body can break down. Okay, over 90% of the ethanol is metabolized in the liver, and much of the remainder is excreted through the lungs and urine. Okay, unchanged. The concentrations in the lung air are consistently proportional to the blood levels. That is the basis of the alcohol blow test. Okay, when the police stand on the road and they ask you to blow through the alcohol blow meter. Okay, if you are drunk, okay, if you have taken alcohol, the air you breathe out as you breathe into that machine will just show you the level of alcohol in your blood. So if that level is higher than the legal level, that is the level above which now you are considered drunk, then that is drunken driving and you answer for it, you are charged. But as you know, Kenya is Kenya and this world is crooked. Somebody went to court and challenged this test, and so it was shelved for some time. The reason they want to be free to drink, why should they adults be told what to do? Okay, the argument of the devil and his angels. Why should God tell them what to do? Now, an adult metabolizes 7 to 10 grams, that is 150 to 220 mils of alcohol per hour. This is equivalent to one drink. One drink of a bottle of beer is 284 mils. It's equivalent to 90 mils of wine. Is equivalent to 28.4 mils of 80 proof spirit. That is spirits like Pilsner, Guinness, okay, spirits like Changa, okay, they're called 80 proof spirit. Very little of it is needed to make you drunk and to reach the drunken level. Okay. So you can only metabolize, break down so much. If you present the body with more than it can handle, then it accumulates in the body. And that accumulation in the body is what causes problems. So that theoretically, one can actually take alcohol and not get drunk. Okay? But that is as long as your body is normal and you're taking a quantity that your body can easily break down. And I think this was the sense of it when God allowed it to be a metabolic product of breakdown of sugars. Even if the sugar had been turned into alcohol, but you didn't take concentrated solutions, what is there your body would be easily able to break down. Okay. So that is where the issue is, that small quantities may do nothing to you, but beyond certain quantity, it accumulates in the body and begins to cause damage, reactions and damages. An adult metabolizes 7 to 10 grams, okay, of beer per hour, okay, equivalent to all that. So you drink more than this, okay, it begins to accumulate. Ethanol is oxidized to acetaldehyde by alcohol dehydrogenase enzyme. Excess of the NADH is produced and cofactor NAD+ is depleted. Now that is pure chemistry. Many of you may not be interested in that. But all I want you to get from here is that alcohol taken, it is broken down, but the body can't break it fast enough. So it starts to accumulate. And the enzymes which break it down are that alcohol dehydrogenase. And then the next one is ethanol is converted to acetaldehyde. And then after that, acetaldehyde is converted to acetic acid, which is further broken down into carbon dioxide and water. So the metabolic products are safe, okay, innocent. But acetaldehyde is a poison, just like formaldehyde, the formalin you use in the mortuaries and the laboratories to preserve bodies. So as you continue to drink one bottle after another, blood levels continue to rise. At blood levels above 100 milligrams per deciliter, another set of enzymes called microsomal enzyme oxidase system is induced and contributes significantly to metabolism. NADPH cofactor is depleted and toxic byproducts are produced, that is toxins, free radicals, hydrogen peroxide. These are released. There is the increased clearance of drugs eliminated by this system. Acetaldehyde, just like I've said, is further broken down by aldehyde dehydrogenase to acetic acid. This reaction is inhibited by those listed compounds. Disulfiram, metronidazole is flagyl, common name. And the common name for trimethoprim and this combination is septrin. Then these others, called kefotet, and those are antibiotics. Okay, so breakdown of alcohol can be inhibited by some drugs. When that happens, of course, the level of accumulation in the blood is faster, rises higher. And so accumulation of acetaldehyde being a poison like formaldehyde, will cause an unpleasant reaction of facial flushing, nausea, vomiting, dizziness, and headache. So there is accumulation of ethanol and then in the blood causing problems. As well, there are breakdown products that cause problems. NADH and all these compounds body that causes imbalance in the blood, like alanine. Once starvation is slow, but you eat properly, it will help. Now, on the other hand, ethanol reduces absorption of glucose, amino acids, calcium, folic acid, and vitamin B12. Ethanol causes high levels of triglycerides. We call it hypertriglyceridemia, leading to a fatty liver. And most alcoholics, if you take a scan of their liver, they have a fatty liver, a liver where a lot of fat is deposited and can't function properly. It will also cause hypoglycemia, low blood sugar levels, hyperuricemia, that is high uric acid levels. This is secondary to the accumulation of lactic acid. And that, of course, can precipitate gout arthritis. Many people, when they drink, they get those severe excruciating pains, either in the knee, the ankle, or in the first joint of the big toe, Okay, it is because of this issue of acid going up and uric acid accumulation going up. Okay. Now the pharmacodynamics, that is exactly what does alcohol do in the body. Okay, it accumulates, but when it accumulates, what does it do? It, in summary, alcohol destroys several enzyme systems in your body. It interferes with them. It interferes with the nerve conduction. It interferes with the normal function of nerves and the brain. This damage to enzymes and to proteins everywhere in the body is the reason alcohol causes damage. And so below is a long list of diseases caused by alcoholism. Okay, those details are for medics. Now, something about acute effects of alcohol. If you just took alcohol, okay, we were not taking it before, but then you come and you take it. We call it acute effects of alcohol. Alcohol effects on the nervous system constitute the characteristic signs and symptoms of alcohol intoxication. Being a sedative hypnotic drug, alcohol as a CNS depressant, it is a CNS depressant, which in small doses interfere with cortical processes and in large doses causes coma, respiratory depression, and death. Okay. Small amounts of alcohol, that is 1 to 6 ounces, which is about 30 to 170 mils, in an non-alcoholic has the following effects. Okay, a non-alcoholic, for the first time taking alcohol, okay, a small amounts between 1 and 6 ounces causes the following, the following problems. All motor functions, that is movement and coordination, all motor functions are slower, inaccurate, and random. So don't ask him to point something or to pick a needle or to write something. You'll be trembling. No control, no coordination. The learning process is slowed and less effective. Association is hampered. Attention and concentration is reduced. The faculties of judgment and discrimination, the ability to think and reason clearly, is impaired. Blood ethanol concentration and effect. Okay, so you see what alcohol does if you drink acutely. This is what it does. All learning is impaired. Memory and all that thinking and decision making. Okay, but now what about if you continuously take and it keeps on rising? At low levels of alcohol intake, about 30 milligrams per deciliter, it causes just a mild euphoria, that is this pathological happiness. At 50 milligrams per deciliter, there is slight incoordination of the limbs and the body. At 50 to 100 milligrams per deciliter, inebriation and slurred speech is caused. Emotional instability, incoordination, and loss of sensory perception. Is the order of the day. 100 to 300 milligrams per deciliter. Now this is intoxication. The patient has blurred vision, ataxia, that's difficulty initiating movement, emesis, they vomit. You notice alcoholics almost always vomit. Stupor, that is semi-consciousness, convulsions, yes, and of course, if it goes higher, above 500 milligrams per deciliter in the blood. Now, this is severe intoxication. The patient goes into coma, hyporeflexia, hypothermia, that is reduced reflexes, reduced temperature control, respiratory depression, breathing is reduced, and death is the consequence. Okay. The alcohol content of alcoholic beverages ranges from 4 to 6% for beer, 10 to 15% for wine, and 40% or higher for distilled spirits. A glass of beer has 14 grams of ethanol. Okay, same as in a shot of spirits. The legal level of alcohol, that is the level, the concentration in your blood, which if you have that level, we consider you drunk. In men, it is 80 milligrams per deciliter. In ladies, it's 60 milligrams per deciliter. Now, this drunken level is produced by about 2 glasses of beer, 1.5 glasses of wine, and half a glass of spirits. Okay, so all those are enough to make you drunk. Young people unaccustomed to alcohol may go into a coma at levels of 100 to 200 milligrams per deciliter of alcohol. Permanent neurological damage may be caused in children and those who have not eaten for 8 to 12 hours. Now, what are the other effects of that? Is in the brain, okay? The changes it brings, it causes in the brain. And I have not added there brain atrophy, loss of mind, psychosis, and dementia, total loss of knowledge. Okay, so the list is long. Now, what damage does it do to other organs? In the heart, alcohol causes significant depression of the myocardium, and at levels of 100 milligrams per deciliter. So one has to be very careful, even with this alcohol as far as the heart is concerned. Then smooth muscles of the body. Ethanol is a vasodilator and may cause severe hypothermia in cold environments in overdose. When you see somebody drunk, sleeping on the side of the road, it has just rained on him and the waters of the gutters are flowing through him. You know, he's in coma. And it's just a miracle these people don't die. Okay. They experience a lot of bad cold and they may die because the blood vessels are dilated. It is on the surface, and somebody else with they will lose the heat and they will go into coma, and it can even kill. Alcohol relaxes uterine smooth muscles. Now, that is for acute alcohol intake. In chronic alcohol intake, what are the effects? 10 to 20% of drinking population are unable to control their alcoholic intake, a condition called alcohol abuse. Those who continue to drink in spite of adverse medical and social consequences suffer from alcoholism. Alcoholism is a complex disorder that appears to have a genetic as well as environmental determinants. So there is the story, okay? People drink, many people drink, but as I said before, that there are people who drink and they seem to have a control. But a fraction of those who drink, at any time, 10 to 20% of them, they become helplessly drunkards, okay? And they are alcoholics, okay? Chronic alcohol intake profoundly affects the function of several vital organs, particularly the liver. The tissue damage results from a combination of direct effects of ethanol and the metabolic consequences of processing a heavy load of metabolically active substance, the one ethanol. Specific mechanisms implicated include increased oxidative stress coupled with depletion of glutathione, damage to the mitochondria, growth factor dysregulation, and potentiation of cytokine-induced injury. Those are technical terminologies, but what it is saying there, trying to explain how alcohol brings the damage. So these are real scientific facts that are being displayed here. And that's what I'm trying to do, to show you how alcohol causes damage. Increased death rates are caused by liver disease, cancer is far-reaching. And so now the specific diseases, I've just said in a summary that it will affect the brain, the nerves, and all the other organs. And I've mentioned even a few, but now in a little more detail, the long list of diseases caused by alcohol in various organs, in the brain, in the nervous system, the CNS. The problem number one is alcohol addiction, okay? Alcohol intoxication leading to drunkenness, blackouts, and coma, and of course, addiction and dependence. Withdrawal syndrome of alcohol. If you are drinking continuously, then you stop suddenly. You experience tremulousness, hallucinosis, RAM fits, delirium tremens. Okay? Delirium tremens is an uncontrollable, agitated, confused patient who can destroy others and destroy themselves. Okay? they have tremulousness, they are having hallucinations, they're seeing visions, alcohol-induced visions, and they have convulsions, RAM fits. It causes some nutritional disorders, okay? Wernicke-Korsakoff syndrome is a disorder where you have got a difficulty moving, you have got paralysis of the eyes. Alcohol will cause polyneuropathy, damage to several nerves, okay? Then it will cause optic neuropathy, that is damage to the nerve that makes it possible for you to see. It will cause pellagra, okay? A disease associated with death. Diseases of uncertain pathogenesis include cerebellar degeneration. It chews literally the hindbrain, the cerebellum. These others, okay, where there is damage. And then, of course, it causes muscle damage. Chronic cerebral degeneration, that is chewing of the brain. So the whole brain is chewed, the hindbrain, the cerebellum for balance, and the forebrain, most of where you do your thinking and memory. And then, of course, the physical tolerance and physical dependence. In the gut, the gastrointestinal system, alcohol will cause gastritis, peptic ulcers, nausea, vomiting, abdominal pain, and diarrhea. Alcohol will cause malabsorption, it will cause fatty liver, it causes alcoholic hepatitis, inflammation of the liver, which advances further to scarring, and this scarring is called liver cirrhosis, which can go further to liver cancer, liver failure, and death. It causes acute and chronic pancreatitis, the gland that digests your food. So if you now damage it, now the digestion of food is impaired, and the food you eat goes to waste. It just goes out in the stool. And of course, you develop diabetes when you destroy the pancreas. In the circulation system, alcohol will cause heart muscle disease, irregular heartbeat, that's cardiac arrhythmias, and heart failure. Alcohol causes hypertension and strokes. Alcohol increases cholesterol levels. It causes hypercholesterolemia. In the respiratory system, alcohol exacerbates asthma. In the genitourinary system, alcohol causes subfertility states. It reduces your fertility in both males and females. So getting a baby becomes more challenging. You can do all the gymnastics of sex and still be unable to get a child. Sexual dysfunction is affected, okay? There is decreased arousal, increased ejaculatory latency, decreased orgasmic pleasure in men, decreased libido, decreased vaginal lubrication, and menstrual abnormalities in women. In other words, it just interferes with the whole spectrum of sexuality in males and in females. Now, despite that, we know that there are a few alcoholics that breed like rats. Now, those are exceptions, but the majority, the rule is interference and damage to the sexuality. It causes impotence in about 50%, testicular and ovarian atrophy, okay, acute urine retention, and risky sexual behavior. I always love it when Muranga, Kiambu women, Meru women, Taita women, they gang up and they attack Changa brewing dens. They break the pots, pour the alcohol out, beat the brewers, chase them away. And if they can, they arrest them and deliver them to the police. They complain, our husbands come here spending all the time drinking, okay? And they drink all their money, and they are not responsible. They don't help us with work at home. And of course, when they come home, they can't perform in bed, okay? The alcohol has destroyed their sexuality. And I say, well done, ladies, beat them more. We clap for them. They should destroy all that Changa brewing and the places where their men drink. The other day, the Kiambu women were demonstrating, saying, our men are not giving us children. They were threatening if their men can't give them children, they will all go to marry Lewis to give them children. In the skin, there are dermatological problems it causes. There's a skin disease called psoriasis, several of them, those listed there. And it also causes low-grade skin infections. Alcohol affects not just the mother, but even the innocent baby within the mother. It causes teratogenic effects, that is abnormalities of organs when a child is born. It causes intrauterine growth retardation, microcephaly, that is small miniature brain, poor coordination, facial disfigurement, joint abnormalities, okay, facial dyshypoplasia and joint abnormalities. Alcohol is a leading cause of mental retardation, congenital abnormalities, okay. In the blood, it causes anemia, reduced platelet counts, and bone marrow depression. Bone marrow is where the blood cells are produced. So if you suppress it, now you can't have enough blood cells. Of course, that means anemia, that means infections. It increases platelet, it decreases even platelet counts. Because of drunkenness, alcohol predisposes people to trauma, and repeated trauma, minor trauma, causes, has mental, psychological consequences in the brain, leading to dementia. Then psychological and psychiatric challenges. Alcohol leads to anxiety, depression, paranoid ideation, paranoid schizophrenia, that is madness with suspicion, suspiciousness, envy and jealousy, personality change, phobias, insomnia, lack of sleep, misuse of other drugs of addiction, and cognitive impairment, inability to learn and remember things, okay? Drinking alcohol opens the gate for use of other drugs of abuse. And these challenges occur in 10% of men and 4% of women. The social problems brought by alcohol, family problems, marital discord, financial difficulties, repeated road traffic accidents and driving offenses. Employment is affected by absenteeism, like the young people who, when they get their salary, they will not report to work for a week until they have drunk all the money. That's when they will come back to work. And neither are they seen in their families. They will go and drink it all with prostitutes and come home when only a little is left or nothing is left. There is absenteeism at work, there is reduced work performance, there is redundancy. There is decline in social standing with loss of friends, social roles, and hobbies. And they have to keep hiding with frequent changes of address. Children's problems associated with alcohol, okay, injuries, sexual abuse, stress. That is parents who drink, okay, they will end up with sexual abuse on their children, with stress, behavioral problems, poor school and exams performance. Alcohol causes a number of cancers: pharyngeal cancer, laryngeal cancer, mouth cancer, esophageal cancer, colonic, breast cancer, liver cancer. Okay, 15% of people with liver cirrhosis will turn into liver cancer. The kidney is not spared either. It causes immune complex, nephritis, and renal failure. So all these conditions generally improve when you stop with abstinence, okay? In cancers, alcohol is thought to act as a carcinogen, that is a co-carcinogen or a promoter of cancer. It is synergistic with smoking. So if you drink and smoke, your chances of cancer are even higher. Alcoholic beverages contain carcinogens, that is cancer-causing chemicals like nitrosamines and polycyclic hydrocarbons. So the acute effects of alcohol are transient, largely predictable, and pathologically largely insignificant. The chronic effects, the effects of chronic intake are much less predictable, remarkably diverse, and dependent partly on the quantity drunk, the period of drinking, and the maturational state of the drinker and genetic factors. Continued drinking leads to progressive damage and organ failure. Now, suppose you are drinking and you suddenly stop. I'd already stated it, but let me repeat again. The withdrawal syndrome. That is, if you are drinking and you stop, okay, you experience these withdrawal signs and symptoms. And the way to stop them is to take more beer, okay, to suppress the reactions. Chronic excessive alcohol consumption results in development of withdrawal signs and symptoms. And the severity depends principally on the amount, on all that, okay? Then other factors which worsen alcohol effects include infections, diabetes, injury, withdrawal of other brain depressants, which may also potentiate it. There is marked variation which occurs from one withdrawal episode to another, even in the same patient. The way they react today is not the way they will react next week when they stop drinking. Those who have had delirium tremens and convulsions are likely to have them again. Withdrawal can be minor or major. The minor withdrawal appears within a few hours, 6 to 12 hours, when blood ethanol levels drop to zero or sharply declines. There is nausea and vomiting, apprehension, weakness, faintiness, excessive sweating, irritability, agitation, hypertension, insomnia, lack of sleep, that is tremors. Full recovery is within 24 to 72 hours. Intermediate withdrawal. In addition to the features of minor withdrawal, they may develop hallucinations, convulsions, and abnormal heartbeats. Hallucinations occur in less than 5%, 12 to 24 hours after cessation. They are auditory, that is, you hear abnormal sounds, you experience strange feelings or touch. They usually do not have visual hallucinations. They do not see things. They just hear things and have this touch feeling, abnormal touch feelings, as if something is crawling over your skin, usually unpleasant or threatening. Withdrawal fits occur in 2% of the patients at 24 to 48 hours, and occasionally they will have status epilepticus. Major withdrawal, that is when you've been taking high amounts for a long time. It's also called delirium tremens. It occurs in about 5%. They have severe agitation, confusion, delusion, gross tremulousness, and rapid pulse, and excessive sweating. Patient is disoriented, has visual hallucinations. The auditory may have extreme fear and apprehension, leading to aggressive, destructive, and suicidal behavior. They tend to occur at 48 to 72 hours and last 3 to 7 days. Mortality is low with treatment of delirium tremens. The diagnosis I will skip. You just find out how they are drinking, and then you offer them treatment. There are various treatment modes. Once you have diagnosed that somebody has an alcohol problem, you give them a questionnaire to fill, and you take detailed history of their problems, and then you offer them help. You will not get anywhere if he does not recognize that he has a problem and needs help. Okay. So we have these general clinics where the treatment can start, but then they must be referred to specialist clinics who know how to handle these problems, generally psychologists and psychiatrists. Well-person clinics, elderly screening for those over 75, you may discover them during these procedures. A general questionnaire including inquiries on smoking, diet, and exercise may be more useful, and they should be designed to give quantitative estimates of how much they take. Okay, there are those standard questionnaires, instruments we use for interrogating these patients and making a diagnosis. So once we make a diagnosis, what we do, if it is severe, we admit the patients and take them through a 2-week period of what we call detoxification. That is, you withdraw all the alcohol, yet they are confined to the ward. If they have withdrawal signs and symptoms, you give them drugs to alleviate those withdrawal signs and symptoms. And so slowly but sure, with difficulty, they are able to endure the torture of withdrawal until by 2 weeks they are over it, it stops. Okay. You continue reassuring in a calm and well-lit environment. Severe withdrawal requires both hospitalization and drugs, but you must remember to personalize the treatment. The drugs which can be used in helping people to stop alcohol, okay, are long-acting drugs like Valium. You give them by mouth in mild to moderate cases. In severe cases, you inject them. Then those other drugs listed there, they are available: beta blockers, clonidine, carbamazepine. Those who are having hallucinations and tremors, you give them those drugs for treating madness, okay, psychosis. Those who have abnormal heartbeats, of course, you handle it. Those who have infections and trauma, you treat it appropriately. Then encourage them to have a good, well-balanced diet rich in proteins and vitamins. And always give vitamin B1 before giving glucose to these patients. Now, alcoholic dependence. There are many methods of helping them. So that was in the acute case. But now alcoholic dependence, many cases spontaneously remit as the patient realizes and appreciates the problem and gradually modifies his alcohol intake. Self-help manuals, he keeps a record of innocent intake and slowly but steadily reduces daily intake until they are drug-free or help arrives. Treatment is mainly psychosocial. Pharmacologic treatment is limited but works better when combined with psychotherapy. Several drugs are used. Disulfiram is typically used. If you use it, you get very bad reactions with alcohol. That's the basis of its use. Get throbbing headaches, palpitation, tachycardia, that's rapid heartbeat. And with large alcohol doses, arrhythmias, abnormal heartbeats, hypotension, and collapse. Even small doses in oral medications may provoke a reaction. So start within 10 minutes and it may last for hours. It should only be used under specialist supervision. A station facility is available. Patient should be stable and well motivated. Okay, so those dosages given there. The other drugs are naltrexone and acamprosate. Okay, it is severe, given in these drugs here. Okay, acamprosate is contraindicated in severe renal disease. Okay, other drugs in trial are those listed: topiramate and ansotrate, baclofen. Specialist units are used for individuals and group therapy, social skill training, marital and family therapy, and work rehabilitation. Rehabilitation houses and therapeutic communities. There are people who have offered built homes just for these people to help them out. Okay, that's all I want to say about alcohol. But other alcohols like ethanol is an industrial solvent, and it is turned, when you take it, it is turned into formaldehyde, which is formalin. And that's why when they drink spiked beers and changas, in which they have added methanol to increase the alcohol potency, then people become blind suddenly as they are drinking. Okay. Death is caused by a sudden respiratory arrest. Levels above 50 milligrams per deciliter. Dialysis is indicated. Formulate levels. Metabolic acidosis will be increased in a gap and a smaller gap, and carbonate reduced. The treatment itself support respiration and all that. Okay, we have our way of doing it, those enzymes and drugs. Then ethylene glycol is another alcohol, commonly industrial solvent, and in our laboratories, it has its problems like renal failure and oxalate stones and metabolic acidosis. Okay. Okay, that's basically about all that I want to say. Okay. So hemodialysis, ethanol infusion, fomepizole, to discuss alcohol. Okay, so I think I want to end it there and ask if there are any comments before we close. So the message this evening is alcohol does damage to your body, every organ, every system. There's no system impaired. It does that, and the damage is worst in chronic alcohol intake. The higher the amount you take, the higher the more the damage. It is not worth drinking. It is a poison. That is why we use it as in sanitizers. During COVID-19, you see all the sanitizers are alcohol-based. It kills bacteria and viruses, and that's the same way it kills your cells and kill you. Okay. Any comments, any questions? Okay, no comments, no questions. Please, if you remember, if you have any questions, just write them down, and we'll have a question answer session on Sabbath. Thank you very much. God bless you. Is anybody still with me?
Thank you, Dr. for the presentation.
Okay.
Yeah, so I think we'll just do the final prayer, then we close.
Okay.
Yeah, so let's pray. Father Divine, we come before you once again. We thank you for this evening. We thank you for the lessons that you've taught us, Father Lord. And Father, we thank you for the knowledge that you've given Professor, that is able to disseminate in a manner that we are able to understand, Father. I want to take the opportunity to pray for those who are ravaged by drugs, Father, those who are struggling with drugs. And for today, Father, I want to put before you those who are suffering from alcoholism, Father, and even those who are on that path and are sliding towards the path of alcoholism, Father. How we pray, Father, that you also give us the understanding to know how to help them to get out of this challenge, Father, Lord. And Father, may you bless us, even those who are parents, that we might be able to teach our children in the right way, Father, that they might not find themselves going into that path, Father. How we pray, Father, that as a church, we might be able to have more and more programs to be able to help those who are suffering from this particular challenge of alcoholism, Father. We want to pray that you may be with us tonight as we're going to sleep, bless us, and keep us safe in your keeping till we meet again. For in Jesus' name, pray and believe.
Amen.
Thank you.
Okay, so thank you very much, members. We'd like to close for today, and we pray that we meet tomorrow at 8 o'clock as we start the program and as we continue with Professor. God bless you, Professor, and may all of you be blessed. Good night.
That's